This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast. Welcome to a show that we like to call Prostate Cancer Real Talk. Did you know that in the U.S., 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But hey, we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors. A place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. Our hosts, Elle and Shay. This is Prostate Cancer Real Talk. We are pleased to continue our conversation with Dr. Natalie Reizine of the University of Illinois Cancer Center. She is a physician and researcher in the Division of Hematology and Oncology at UI Health and the University of Illinois Cancer Center. As a medical oncologist, Dr. Reizine specializes in treating genitourinary cancers, including prostate, kidney, bladder, and germ cell tumors. She strives to be her patient's advocate and to facilitate shared decision-making. Dr. Reizine's research interests include developing and designing clinical trials to improve personalized treatment approaches for cancer patients. She studies how genes impact her patients' response to medications and therapies, and she hopes to reduce her patients' toxicities to treatment while maximizing their therapeutic benefits. In this episode, we further explore the topic of clinical trials in prostate cancer. Elle and Shay, take it away.
So, Dr. Natalie, you mentioned the term biomarkers several times. So could you please describe that and how that plays a part of the clinical trial that you're involved in?
So PSA is can be considered a biomarker. So it's basically a biomarker is some type of signal that informs us of what's going on beneath the surface with the cancer. So in this specific clinical trial, we will be looking at a number of different biomarkers like PSA. We'll also be looking at other hormone markers like testosterone, different inflammatory markers and growth factors, and then also changes in gene expression within the prostate cancer itself, to see if we can give a clue as to how licorice root may or may not be interacting with the prostate cancer.
You mentioned testosterone. What relationship do testosterone levels in men have to PSA levels and prostate cancer in general?
That's a wonderful question. So there's actually a very significant relationship. When I'm a medical oncologist, so I normally get involved with the care of prostate cancer patients after it's become more advanced than in your case, Elle. And we talk about treatments that are systemic or go everywhere in the body, because at that time, the prostate cancer, unfortunately, is more advanced. So our treatments need to go everywhere in the body. A mainstay of treatment for advanced prostate cancer is to lower the testosterone levels. As we know that testosterone can, especially in the early stages of prostate cancer, can lead to prostate cancer growth. So one of the main things we will do for patients is called androgen deprivation therapy, or lowering the testosterone level. Licorice root actually has some evidence that it also helps to lower testosterone levels, which is one of the things we will be looking at in this clinical trial.
The clinical trial, is it ongoing right now? And if so, how do you recruit participants for this clinical trial?
We are not recruiting yet. We will be soon. I actually discuss clinical research with every patient that I meet. I I bring it up because I think it's really important that patients know that it is an option, an opportunity, should they be interested. I respect if they say that they don't want to talk about it, particularly at that visit, but I try to leave the door open so that they know that I'm an advocate in that space and that we could talk about it should they ever want to. When we look at disparities in clinical trial enrollment, it's actually because patients are not being asked. Either they're not at an institution that offers clinical research, or they are just not being asked. So I think it's really important that everybody has equitable access to clinical trial enrollment. So that is certainly my approach. We have other clinical studies open at UIC. And that's been my approach with helping with clinical trial enrollment. And that's our center's very, very, very engaged with that. Kind of as we talked about in the beginning, we are really dedicated to enrolling underrepresented minority patients. We've actually enrolled 79% of our patients enrolled on clinical trials are underrepresented minority, over 50% Black. So this is something that we're very passionate about and very much working very hard as an institution.
We know that Black men are 50% more likely to get prostate cancer and twice as likely to die from it. So I want to get your perspective on that, and also to talk about, the importance of the work that you're doing and clinical trials in the area of prostate cancer, and why Black men in particular should consider or be more open to research in this area, clinical trials and whatnot.
Thank you for that question. And your podcast intro does a great job of summarizing those statistics that you just mentioned. So as you know, Black men are more likely to be diagnosed with prostate cancer at a younger age than white men. They're also more likely to be diagnosed with more advanced disease with more aggressive features. So what I would say is that clinical trials is ultimately how we make headway in cancer treatments. It's how we improve upon what is the standard of care and decide if new therapies are not only safe, but also more efficacious than the standard of care that we already have. Many cancer clinical trials, including for prostate cancer, in the past were not done on very diverse patient populations. There are many people that are trying to rectify this and to fix this, but it's incredibly important that clinical trials include all diverse individuals. The results of these clinical trials ultimately lead to FDA approvals for drugs and widespread use of what's available for patients. And when I look at the data that's informed clinical trial, results and FDA drug approvals, it really doesn't include a lot of patients that look like my patients. So I'm very passionate about making sure that the patients I see in clinic are represented in clinical trials, and also that the patients that I see in clinic are enrolled in clinical trials that they are passionate about as well. So in this study, we will be looking at not just biomarkers or signals of licorice root, but we'll actually be learning a lot about prostate cancer in men in general. And of course, whether or not licorice root could play a role. Separate from that, I'm also going to survey the patients enrolled about their experience on the clinical trial, what went well and what didn't. The community advisory board that you're a part of will help me analyze this data. And then hopefully my hope is to disseminate and then present the data back to the community, which will then inform the future clinical trial designs like what we talked about just a few minutes ago.
So we know that there is, as you mentioned, an underrepresentation of minority men, particularly Black men, in clinical trials and clinical studies in the area of prostate cancer. So what can we do collectively, and what methods are in place to increase the participation levels and to reduce the reluctance? There's a reluctance within the Black community for participation in clinical trials and things like this. So what have you and your colleagues done, or what have you discussed that you can do to alleviate some of those apprehensions about participating in clinical trials and studies like this? And what are your plans to implement those things in order to make sure that we do get a representative sample size going forward?
Well, certainly opening clinical trials that reflect the community's values, and also opening them at centers like UIC, which take all in-state Medicaid and uninsured patients and all patients who may not have access to clinical trials elsewhere. That's really important, is to make sure that all patients who are eligible are offered the opportunity should they be interested. Separate from that, I always make reference when I meet a patient that clinical trials are an option at any stage, and that their involvement is completely voluntary. That, if they're not interested in participating, that does not change my care of them, my standard of care of them, or my opinion of them, or anything. And I just want there to be an open door so that they are comfortable to talk about this with me in the future, should that come up. And if it doesn't, then that's okay. I still am very glad to take care of them and give them the standard of care treatment. The other thing that I personally do in my practice is, when I'm talking about clinical research, I find it really helpful to explain to patients and their families, where does this particular clinical trial fit in to the treatment landscape right now? So what question is this clinical trial asking? Where would it help us? What are these unopened questions within the field of prostate cancer that we're trying to improve upon? And where would this clinical trial fit in? What would if we figure out what the future results look like, how would that change practice? And then from a feasibility perspective, I think it's really important to make sure that patients have access to the clinical trials and know what's involved with them. So there can be, in my clinical trial, we're not going to do extra biopsies, but we are going to take extra blood. We're going to try to combine it with standard of care blood draws that the patients could get, but there may be extra visits. There will be surveys. I think it's very important to let patients know what they're signing up for and what they're committing for, and making sure that patients are adequately compensated for their time.
Okay.
So I wanted to know, if a listener is out there, whether it's your clinical trial or one that's perhaps in their area, what should they expect? Like, in terms of actually, if it's in your case, it's licorice root, how often should they expect to consume or have to take licorice root for the study? So
in every clinical trial will be different. So I think that's a great question. Mm-hmm. So when you are talking about a clinical trial, it's very important to talk about what is the study intervention, what will be the commitment, and what is the time frame. Mm-hmm. In my clinical trial, patients will, once they have decided upon surgery and they've decided that they want to enroll in the clinical trial, if they're interested, they will actually be randomized, which means that a computer software will decide which study arm they will go into. Mm-hmm. And there will actually be an observation or a control arm where patients are not going to take anything. They're just going to get their surgery, as normally scheduled. We will still ask them to donate their tissue specimens and their blood specimens so that we can compare them to the licorice root arms, but they will not take anything. They will just go through their treatment. Then there will be a low dose arm. So it will be a lower dose of licorice root and then a higher dose of licorice root. And patients will be randomized, and they won't find out until after they've enrolled which arm they will be on. So it's important to ask these types of questions about the study design and everything up front. And it's also important to know that you can always change your mind after you've enrolled on a clinical trial too, if you don't feel like it's safe for you. And your study team's not going to be upset about that, because everybody wants patients to have the opportunities that they're interested in.
So I made some notes here, and I have 3 words, okay, that I'd like for you to address. Number 1, cost. All right. Is this going to cost me anything to participate in this study? I mean, are you going to help me by transportation back and forth to the facility to do whatever I need to do in order to participate. The second word I have written down here is privacy. Is my information going to be private? I don't want to be, quote, a guinea pig. Somebody going to take my clinical information and share it or whatever. So there's a privacy concern. And then social taboos. Okay. I've heard about these studies before, and whether these taboos are normally taboos are not accurate. That's why they call them taboos. But what about the social aspect? Well, why should I participate in this? So how would you address those three words?
Those are tough questions. Those are tough questions. So
that's why we're here. That's why
you're here. Yeah. I'll start with the first one, which is the cost one. So at our center, we actually, for patients enrolled on clinical trials, I'm very proud of this, that we are able to provide rides for research related visits, because the Cancer Center understands that there may be extra visits. I mean, people are working, people have lives, parking costs money. So I think that those are one of the things that needs to be routinely implemented for clinical research to make sure that it's equitable to all, in terms of certainly making sure that patients aren't spending money to be on clinical trials, and then also having money in there in terms of compensation for patients' time. So we do have both of those. We do have both of those things. I mean, it's certainly not a lot of money, but there is some monetary compensation that I applied for a grant for. I applied for money so that I could compensate patients that would want to enroll. The second question was
privacy.
Privacy, yes. So that's a huge component of all clinical research. All clinical research trials are overseen by institutional review boards, IRBs. Of which UIC, of course, has one that reviews every single clinical research protocol, and actually has patient advocates who sit on the IRB board and also review the protocol and the consent form to review clinical research studies from a patient perspective. And loss of privacy is always a risk of clinical research. We have embedded plans with safeguards to prevent that as much as possible. But if you ever read an informed consent, it will say that loss of privacy is always a concern as part of being clinical research. In this study in particular, and in most studies that I've ever been involved with, the patient gets enrolled to the clinical trial, but then they basically get put into a database assigned to a number. So the patient's name and any other private health information is never affiliated with them with the clinical research data. They get assigned a number which de-identifies them in that database. And then that is the database that then gets analyzed for the outcomes or the biomarkers of interest. So it wouldn't put your name in there, or your birth date, or your MRN, or your zip code. None of that would be in there. You would get assigned a number, and then that's data that gets analyzed. Okay. So that there's many different techniques like that all clinical research studies work on, and that the IRB specifically reviews and makes sure it's as safe as possible.
Okay. And then the last one is probably the hardest one, the social taboos, particularly within the Black community. I don't know, there's just a trust level between the medical industry and the research industry and the Black community in particular?
Well, I think education and transparency. I always want to be sure that patients know that there are opportunities should they be interested in. But again, I don't push if they are not interested or don't want to talk about it that visit. And I won't bring it up again if they say they don't want to talk about it, because I have to respect where they've come from and their perspective. I think that I think many patients just aren't aware of what clinical research opportunities are and what they entail, because there's many different types. So in this trial, we're talking about an intervention, which is the licorice fruit. I think at the lab mixer that you were at, Elle, they were actually highlighting a biorepository, which is just where patients donate their tissue samples. So that will ultimately be a part of this study as well, that patients will have the opportunity to donate for a biorepository. But that is a different level of research commitment, whereby you are saying, like, I have extra tissue. It's okay for it to be studied by researchers as long as, my name's not there and it's de-identified. And that's something that's been very successful. I mean, it's the biorepository at UIC is for the prostate cancer is 2/3 Black men. So I think that can also be there's different levels of research commitment. There's different levels of clinical trials. And I just always try to be upfront about what is the question answering, like what is the clinical trial trying to answer, and what is the expected benefit that could happen. Some clinical trials are just for information gathering. They're to help researchers have hypotheses, and that's important, but patients should know that they aren't going to be expected to be exposed to a miracle drug.
One of the objectives that we have at Prostate Cancer Real Talk is to do exactly what we've done today, and that is to open up the dialogue, to promote an exchange of information, education. As we conclude our discussion, could you just give us a thumbnail sketch overview of the licorice root prostate cancer window of opportunity clinical trial? Also, overview of some of the work that your UIC clinical cancer research is doing.
Just a reminder, to ensure that you stay up to date on the latest episodes from Prostate Cancer Real Talk, don't forget to hit that subscribe and like button.
Absolutely. Thank you so much. And this was really great. I had a great time. You guys have tough questions, though. But so overview. So this is a window of opportunity study. So it's a short period of time where patients will be exposed to a complementary medicine, which we are excited about for the treatment or maybe prevention of prostate cancer someday. But this is the first time it's being studied in prostate cancer patients. So we need to figure out if it has a good signal and if it's safe. And this will be an opportunity for patients to participate in research to help see if we want to move this forward. That should not interfere with their standard of care. So that's the overview of the window of opportunity study. Someday, if this model is successful, we actually could look at other drugs in this space. So not just licorice root. So we could talk about other complementary compounds, or even other more prescription medications in this space as well, where we could look at and see if drugs are safe and look exciting. So that's kind of the overall idea for this. And then it's also helping us to just learn more about prostate cancer in the UIC patient population. Overall, at UIC, we are very committed to increasing both these exploratory research studies, but also these interventional research studies, and looking at novel clinical research opportunities within the patients that we take care of, which are predominantly underrepresented minorities within the Chicago community, who have historically not been included in clinical trials for a variety of reasons, but need to be, because certainly if we're going to make breakthroughs in identifying signals or biomarkers in prostate cancer, or determining which drugs we think are the future of prostate cancer, it needs to be efficacious in all diverse patient populations. And I'm very happy to partner with you on our community work, because I think that everything really starts from there. I want to make sure that the questions I'm asking actually matter to the patients I'm taking care of. While I think that there's a lot of people interested in lifestyle metrics like nutrition, herbs, but also even things like diet, exercise, things that affect our levels of inflammation in our body, things like that, our metabolism, all of these things are becoming a forefront of cancer research. I think we've barely scratched the surface. So that's a whole other podcast, which we can talk about. But there's a lot of data looking at the beneficial effects of exercise, not only in preventing prostate cancer, but of course in preventing the recurrence of prostate cancer. And then for my patients, there's obvious benefit in terms of preventing the side effects of the therapies from prostate cancer. So in terms of bone strength and muscle strength and energy levels, incredibly important for exercise. So I think all of these things need to be evaluated just like we would any other intervention that we would do, which is to study it in clinical trials and really understand what is it doing so that we can advise patients what is the best thing, for them to do. I think what I would say is that, a diet that's, everything within moderation and to exercise, certainly that's all very important. And I would say that the next couple of years are going to be very exciting in this field, particularly for prostate cancer, because again, I think that we're only just beginning to understand how our lifestyle changes can affect our cancer outcomes.
Well, I think it's really wonderful, the work that you and your colleagues at UIC are doing. We actually, the more you learn about prostate cancer, particularly within the Black community, because we're so highly affected by this, it really just makes you wonder, why isn't somebody doing something about this? And so conversations like this will let people know, yes, there are some very dedicated people that are, in fact, doing something about this. As I mentioned, my visit to your facility in October 2022 was extremely enlightening. And I'm glad that we had this opportunity to share the encouraging work that you and your colleagues at UIC are doing. And we want to thank you for taking time to be with us today. So if people want to know a little bit more about this, is there a website or someplace that they can go to get a little bit more information about your work or the work that UIC is doing?
Oh, yes, absolutely. I can provide that with you. I would refer them to the UIC Cancer Center website, where it has my contact information and then also information about all of our clinical trial research programs.
So with that, we'd like to thank you for your time, and we'll make sure that we share this really, really great information with as many people as we possibly can. So thank you again, Dr. Natalie Reizine from UIC here in Chicago.
Thank you, Dr. Natalie, for being on the podcast. Thank you. And we have to have you come back to talk about diet and exercise. That's kind of in our wheelhouse too. So yeah.
That would be wonderful. Thank you so much. This was a pleasure. Thank you.
To find out more information on the guest you just heard or previous guests and a list of Prostate Cancer Real Talk episodes, visit our website, prostatecancerrealtalk.com. And if you have a question, comment, or if you would like to share your story, send Elle and Shay an email, ellandshay@prostatecancerrealtalk.com. That's LEL and Shay, SHAY, @prostatecancerrealtalk.com.